Hi, I'm Dr. Dyan Haspel-Johnson, and it's time for a weekly sleep tip. I've been talking about learning self-hypnosis, teaching you self-hypnosis, giving you some tips, and educating you about that and in the past weeks. And one of the things that's really important to think about is the specifics of your language. So keep in mind here, think about it this way. The unconscious has its own language. It's different a little bit than the conscious mind. So I'm talking to you and I'm using specific words, and your conscious mind, cognitive mind, is taking in those words and it has to decode them and make sense of them. It has to go into its storehouse. That storehouse is kind of an underground basement area with a whole bunch of files, with meanings, with context, with experiences and memories and all kinds of things. And that's all unconscious. So when you're working with hypnosis, it's kind of an interesting thing because it's utilizing conscious language, but it's bridging it to be decoded at a really deep level in the unconscious. So we need to be mindful of the words that we choose and how we choose them. So an example that I often give, this is kind of my pet peeve, is a lot of times when people have come to me with, for example, cancer, and I ask them what they'd like to have happen in a session, especially if we're doing hypnosis or even therapeutically, and they will say, I really want to keep a positive mental attitude throughout my treatment, and I want to really stay positive. And I am like, I'm so happy that you want to be optimistic and hopeful. That's so important. A great attitude is really important. It actually has an impact. Studies have shown that. But could we just shift your language a little bit? Because positive on a biopsy or on a blood test is only something that you only want a positive lab if you want to be pregnant. Otherwise, positive in medical terms means that there's something there. And so when you're talking about cancer, you don't want positive lab results. You want negative lab results because that means you're free of the cancer. You're free and clear. So to me, I think, particularly when dealing with medical things, that's kind of confusing for the unconscious. The unconscious then has to take in that language and it has to figure it out. Like, what do you mean by that? Do you mean you want me to have a good attitude, or do you want me to have a positive result? Like, positive result, is that meaning cancer-free, or is that meaning a positive lab? It just makes your unconscious work a little harder. So this is why I would say to you, just be aware of the language that you're giving yourself, especially around sleep, especially around the problem. This goes into sort of, pleasant and unpleasant, optimistic and pessimistic self-talk. And so just be aware, particularly if you have a specific issue, of what you're saying to yourself and how you're saying it. And we're going to think about that a little bit more as we move into learning more about self-hypnosis. I go into a lot of this in my Deep and Easy Sleep self-hypnosis package. And in that package, there are audios that are different lengths, 30 minutes down to like 8 minutes. And the language is very specific, and it can teach you more about this if you're interested in this concept and in learning self-hypnosis in a more comprehensive way. But otherwise, just keep watching this space and I'll continue to give you some sleep tips. Okay? Sweet dreams.